Hi, I'm Dr. Rob Goodman from Everhart Veterinary Medicine in Baltimore, and I wanted to talk to you today about the TPLO and cranial cruciate injury procedures. TPLO surgery is a surgical procedure performed to address cranial cruciate ligament injuries in a dog's knee joint. The CCL is analogous to the human anterior cruciate ligament, or the ACL. When the CCL in dogs is damaged or torn, it can lead to instability in the knee joint, lameness, and pain. TPLO surgery is designed to stabilize the joint by altering the angle of the tibial plateau, which is the top surface of the shin bone. In this model here, this is the TPLO and this is the top surface of the shin bone. TPLO surgery is typically recommended for dogs with moderate to severe CCL injuries. It is often preferred for large and more active dogs. Your veterinarian will determine if TPLO surgery is suitable for your dog based on factors such as the dog's size, age, activity level, and the specific nature of the CCL injury. The benefits of the TPLO surgery is that it, number one, stabilizes the knee joint. TPLO surgery helps stabilize the knee joint without relying on the torn ligament. What the surgery does essentially is it changes the biomechanics of the knee so that the ACL ligament is no longer necessary for stabilization. You get a faster recovery from doing the TPLO versus other procedures. Dogs usually have improved long-term outcomes. The TPLO aims to reduce the progression of the osteoarthritis in the affected joint. The procedure that we do, the dog is placed under a general anesthetic after it's determined that this surgery is necessary. They are comfortable and pain-free during the entire surgery. A specialized saw is used to do the bone cut or the osteotomy to the tibia bone. And the cut is right along this area of the tibia here, as in this model. The cut allows the surgeon to reposition the tibial plateau to a more level angle. The normal tibial plateau is about 27 to 37 degrees, and the more steep it is, the more chances are that there will be an ACL injury. Once that angle is determined and the bone is cut and the tibia is changed in order to be a more level plateau, a plate and screws are placed on the bone to secure the repositioned tibial plateau in place. After the surgery, the dog's leg is typically stabilized using a splinter bandage for a short time, and then the pet goes home for recovery with medications and antibiotics. The post-surgery recovery, the dogs are required to have limited activity for approximately 4 to 6 weeks, and this is essential for proper healing. Studies have shown that normally it takes approximately 7 to 8 weeks for the bone to heal completely, and after that time, the bone, it's not necessary to have the plate in there. We generally leave the plate in unless there's an issue with it, because it would take another surgery to remove the plate. Afterwards, and which is why we're doing the video in this room, is that we highly recommend doing rehabilitative therapy, and we have an underwater treadmill here. And what this does is allows the dog, the individual patient, after the surgery, approximately 2 weeks afterwards, to start doing walking and supported treatment in the treadmill with water, which removes some of the pressure on the leg and allows the leg to heal more quickly. The other thing it does is it takes the pressure off the opposite leg and allows the dog to walk on that leg more quickly. The sooner the therapy is done, the more quickly the recovery is. The risks and considerations with this surgery, as number one, is with any surgery there are risks involved, including infection, implant failure, and complications. Generally speaking, anesthesia is not an issue. These dogs are generally very healthy and they do very well with that. While TPLO surgery has a good success rate, individual outcomes can vary. It's important to consult with a veterinarian who is experienced in this orthopedic surgery to determine if TPLO surgery is appropriate for your dog. They can assess your dog's condition, explain the procedure, discuss the potential risks and benefits, and guide you through the pre-surgical preparations and post-operative care.